Okay, hi everyone, and welcome to another episode of our Aila Health Patient Spotlight series. I have here with me today Gwendolyn Chilcote, and she is a seasoned barber of 20 years and recently had gone back to school to pursue a degree in microbiology. She has a wife and 5 kids, and she also suffers from post-acute sequelae known as PASC from COVID-19 and is a self-described COVID-19 long hauler. And it's so much of an honor to have you here with us
Thank
today,
you.
Gwendolyn. So welcome to the program.
Thank you for having me.
So to begin with, maybe if you want to just give us a little bit of background and around your health experience and
Okay.
your journey with COVID-19.
Okay. I was sick last summer, around July, and I went in to get tested. I thought it was strep throat. They also did a COVID swab. And by the time I got my COVID results, it had been 3 weeks. And it was negative. And the assumption now is that it was obviously a false negative because at the time where I live, I'm in Montana, rural state, rural setting. So a little slow on everything, slow for the COVID numbers to go up here. And also slow for testing and recovery efforts, which is part of my story because trying to find the correct doctors who understand and can properly treat or even be willing to hear our stories as long haulers has been part of the struggle for me. So I was sick in July and got better. I was, in bed for about a week. And then kind of felt dry, slow, just not great for the rest of July. August came and I was having some GI issues. September came and it was supposed to be my last year in college to get my degree. And I started the semester in September. And by October, I had basically withdrawn. I was doing all of my classes online. They were trying to get people to come back to the university, but I knew my health wasn't right and my parents are severely immunocompromised, so I wanted to limit my exposure. So I was doing all of my classes online. Long story short, I finished 2 classes and took incompletes in 2 classes. By October, November, I didn't have the mental capability, the energy, anything to finish that semester. The GI problems were getting worse. So I wasn't wanting to leave the house. I was having migraines 4 or 5 times a week that kept me in bed in the dark. So most of mid-October, November, December was spent really ill and in bed. My primary care physician was the first one to suggest long haul COVID. So she's been on my side.
And this was 3 months?
Yes.
3 months into your recovery?
Exactly.
Wow.
And she was like, I really think it's post-COVID. But again, there at that time in Montana, nobody was really tracking that. So we were trying to, okay, what do we address? How do we address this? So I saw a GI. We had a colonoscopy, totally normal. He took biopsies and sent them in thinking, well, maybe it's microscopic colitis. But no, it was not. He was like, everything's fine. So I'm going to send you to a different GI specialist who does the upper GI. And I saw him and he didn't even really want to run tests. He gave me a probiotic and like an acid reflux medicine. Did nothing to address the actual GI issues, but grasping at straws. Nobody knew what it was, why I was having these problems. Saw a neurologist. And in that area, I think I'd been to the ER 3 or 4 times with different episodes of shortness of breath and tachycardia and a really high blood pressure. And so my primary care said, I want you to go in and get checked for an embolism or a stroke. Another time I was not able to breathe, really lethargic and diaphoretic, which means sweaty. My body was just drenched in sweat. My wife brought me to the ER. They brought out a wheelchair just to get me in. And they had to wipe the sweat off my body to get the EKG leads to stick. That's how just drenched I was. And every test they ran was totally normal. So the doctor sent me home with some Valium, told me I needed to relax. And I know these are just common stories for everybody. And that's what I think is really important, is getting the word out there and to the medical community, but also to the individuals suffering. It's not in your head. You're not crazy. This is real and it's going on. I think it's interesting studying microbiology now. I'm one semester away from graduating. I've taken a complete leave of absence from school. So that's last spring semester I didn't graduate. And this coming fall, I'm not going to be going back yet either. So, but studying biology and now microbiology and biochemistry, I'm understanding how this virus is affecting our whole body as a system.
Yeah.
And so much of Western medicine is, this is the problem. We're going to treat this and not looking at the overall systemic response that the body makes. So there were ER visits. There was a neurologist, and at that point, it had been over 6 months. So the first neurologist I saw diagnosed me with chronic fatigue, myalgic encephalomyelitis. Didn't deny the possibility of COVID long haulers. He said that he had studied a lot of post-viral neurological issues, but was not forthcoming with addressing how that was affecting me. And basically kind of ripped me off. Like, if you have any questions in the next 3 years, give me a call. I'm your doctor. Oh, by the way, here's some medicine to help with the migraines. And he also did, though, diagnose me with dysautonomia at that time. So I started doing my own research, found the Dysautonomia International website and all the different types of dysautonomia. And being a scientist in my brain, I wanted to get some clear answers. So I found a doctor on their website in Seattle, Washington, and I called them myself, made an appointment. They said, yeah, just have your PCP send over a referral. And I bought a plane ticket. And in the beginning of May, I traveled to Seattle to see another neurologist. And he did some extensive testing, 3 hours of testing, and then about a 40 or 50-minute one-on-one with the physician. And he diagnosed me with mast cell activation syndrome due to the post-viral cascade in my body. My specific dysautonomia, which is most of us long haulers, is POTS, postural orthostatic tachycardia syndrome. And also I have autonomic neuropathy. I describe that for people who don't know. Your autonomic nervous system controls everything you don't think about, but your body does anyway. Your pupil dilation, your salivation or dry mouth, your digestion, your GI tract, blood pressure, heart rate, respiratory rate, blinking, all of those things we don't think about, our body just does. In the virus in my body has started to eat away at those nerves in a way, very basically speaking, so they don't send or receive the correct chemicals at the correct time. So a lot of, and then I also have all the brain fog that everybody has, hard to find words. Short-term memory is pretty much gone, which has been a really big learning curve in our household for communication. Communication is really big for all of us. And when one of the main pillars of the household can't communicate or remember, so that's been one of the kind of daily side effects, is just making sure everybody understands what's really being said or asking for what I need. I still have some testing to go through following up from that neurology appointment. He wants the biopsies they did at the colonoscopy are being sent to Mayo Clinic to do specific staining to check for the extent of the mast cell activation syndrome going on in my body. I also need to do a 24-hour urine test and a bunch more blood work. And I'm seeing a cardiologist in the end of June to do an echocardiogram and a stress test. The reasoning for that is to really specifically rule out any cardiac comorbidities that are present, because that will affect the dosaging of the medicines that they want to give me to try and help. So I still have more testing to go through. And again, a lot of the testing doesn't show us what we want to see. It doesn't say this is your problem and this is how to treat it. Again, it's piecing all those little puzzle pieces together to get the complete picture.
Right. And I think you're speaking to really so many important parts of this, but, one of it being that the doctor's visits after doctor's visits are just yielding normal test results in many cases, feeling like something is not right in your body. And with COVID being something that's so new to the world, and especially, and of course within the medical system, what do we do about these people who are not seeming to get better, or even seeming to get worse after, the acute infection? But the tests are normal, right? So there sounds like there's some of this.
You must be fine.
Some of it. Yes. So, okay, take, just try to relax more. I heard you say that from one of your doctors. And just to be really clear, all of these, these diagnoses that are coming through, this was not something that you were dealing with before you got sick.
No,
right? This is after.
Yeah, before I got sick, I was a full-time student. I also worked at a microbiology lab where we work all with mycology, which is fungus and mushrooms, very detailed, repetitive, have to stay focused type of lab work. And I was a straight A honor roll student at the university. I was involved in 2 different clubs at the university. I was also on the board of directors for a local LGBTQ community center, plus hiking and camping and raising my kids and doing school things with them. I walked to school or rode my bike. So I was walking or riding 3 to 5 miles a day. Actually had been in about the best shape I'd ever been in my life. And all of that has just gone away.
Yeah, it sounds like there's a lot of change that's happening, not just within your own body of experiencing these different symptoms, arriving at, several new diagnoses as you continue to, to be tested. And there's a lot of emotion there. Do you mind speaking to that a little bit,
Yeah, sure. I'd been in therapy. I think everybody needs therapy. The world we live in, just to kind of have a place to go, and have someone give you a couple of little tools to help you not do that in public. So I had already had a wonderful support network, but my therapist has really helped deal with the depression, the anxiety, this might be true for lots of people. In my life, I had learned to correlate my productivity with my self-worth. And those 2 things are not at all combined, but I was an overachiever. And so all of my studying and activities that I did made me feel like, okay, this is who I am. And I'm over 10 months in with long haulers. That's the lesson I'm actually really grateful for, is learning how to slow down and find self-worth in just me as a human and not what I can accomplish in the outside world. It's a really hard lesson. It is not easy by any means, but it's been a necessary step for me in my healing. And again, going back to the science of the human body, when you are stressed, your body naturally releases hormones and chemicals that actually exacerbate our issues as long haulers. From the cascade of the virus inside of us and the cytokine storm, there's also the cortisol storm that comes from stress, and all these other hormonal and chemical markers that keep our body in a state of frenzy. And so by learning to calm myself and using different techniques, because I know the doctors aren't going to just give me a pill and make it all better, I'm going back to basic human health, biochemistry, and nutrition to try and heal myself from the inside out, while the medical world kind of catches up, because I can't just sit here and wait. I feel like I have to do something. And it's helped. I've seen noticeable changes just from the little things I can do at home to support my body through this healing process.
And there's something so empowering in that, right? Like
So true.
having this intimate knowledge that you do about the body, right? You know, you're a microbiologist, and knowing what we know about the autonomic nervous system, like you were saying, and that's what COVID is. It comes in and it just ravages the autonomic nervous system.
Exactly.
And right, and what we know is, there are these things that happen automatically in the body, but you know, we can also exert some control over these automatic functions, like you know, doing these different relaxation practices and that.
Exactly.
And you know, so I love to hear you speak to that, and just hearing, you know, hearing this process of emotional growth for you as well, and like coming through this in a way of relating to yourself differently and how you identify your worth, and just hearing like a real big element of self-compassion in there as well, and like learning to cultivate compassion for yourself as your body is going through this, you know, crazy experience.
For sure.
So, and it sounds like you have, like, along the way, you're developing some tools and techniques that you know, you've been using to cope with and just to support your health. Can you speak, would you speak to that a little bit more?
Sure. One thing my therapist and I were talking about just this week actually was radical acceptance. And there's 4 different things you can do in terms of accepting something. And I'm not a therapist, so I'm not going to try and explain that. But the one thing that really rang true in my mind was, you can't just change what's happening in your body. Accept that, but you can influence it. And that just really hit home to me, because that's what I've been learning and cultivating in those things I do for me. And so speaking to that, a lot of things I've used and tried, I find on the Facebook group. I've found groups that are very open, and people share different things and tactics and techniques. So one of the things I learned, which I have implemented and has changed my life in the last couple of weeks since I started it, is the 50-minute brain break. Our autonomic nervous system isn't doing all these things anymore. So it actually takes energy in our brain to breathe and to keep our heart running and keep our body in homeostasis, to keep it balanced. So a lot of the fatigue is just our body has to work extra hard at staying alive now. Plus, our cognitive ability is diminished. So when we do attempt to read something or even have a conversation like we are now, it's extra energy. So I set a timer on my phone for every 50 minutes. So I start something, I set my timer. When that timer goes off, I just stop. The other day I was in the garden and I was replanting plants, and I just picked up a pot to take the plant out and my timer went off. The old Gwendolyn would have continued and finished that and probably a couple others, and then forgot I was supposed to take a break. Instead, my timer went off. I put that plant down. I came inside. I went to the restroom. I got another bottle of water. I sat down and drank it. And then I closed my eyes and did a few deep breaths. And that's my 10-minute brain break that I read about from another long hauler. And that was suggested to her by her doctors and her physical therapists and her team. And it really helps, because I know a lot of us are like, I only have so much energy, so I'm going to do everything I can until I'm out of energy. And then you suffer. And what I've realized with my family is that when I overdo it and then I suffer, my family is suffering as well. So when I can learn to moderate my energy expenditure and take those little breaks, I have more energy when it's dinner time to devote to my family, and they get some of the good Gwendolyn, not just the burnt out Gwendolyn.
Yeah.
So that's been a really big one. Other things I'm doing is changing my diet incredibly. Actually, just this, since I went to Seattle, I've been traveling, unfortunately. I don't recommend it for long haulers. It takes everything you have to travel right now. But I'm really investigating the mast cell activation and how I can nutritionally support that. I had started a low histamine diet, but I was not very, or low inflammatory diet. I wasn't very strict about it. And finding out more about what this virus has done to my body, the mast cell activation, you can do a lot nutritionally with. So really looking into that and cutting out certain foods and incorporating foods that naturally lower histamine, which that's part of the viral cascade, is inflammation inside of your body. Lots of people are using steroids and things and NSAIDs to help with that. And I'm trying to do that with herbs and food, on top of the things that my neurologist and PCP have prescribed that are actual drugs. And when I get a headache, I don't try and power through it. I drink water and I sit down for at least half an hour and just try and breathe before I take any of my abortive medicines for the migraines, because you're only, I think I'm seeing this a lot in the group. People are getting rebound headaches from using our medications too much. And so when you take the Tylenol or the ibuprofen all day long, you're like, but it helps me feel better. In the long run, it can actually make it worse. So I'm only allowed to take Tylenol 15 times a month, which is every other day, but I've managed. Last month, it was only 5 times. And I only needed to use my migraine medicine 3 times.
Wow, that's great.
So this is, remember, it was 5 days a week and not moving. So that, and the liquid IV, I'm not a sponsor, I'm not paid, but it's a powder mix. So really staying hydrated. Dehydration is your enemy right now. So over 2 liters of water a day.
Yeah.
Those are some of those things, and really working on communication with my family to get that support.
This is so incredible. Thank you so much for sharing some of these tips and these tools that you're using in your own self-care practice. And it can be so difficult to see the silver lining when you're in the thick of it and you feel like crap and you just are struggling. But something that I'm just hearing coming, listening to you, what's coming through so strongly, 2 things. One is just the really the healing effects of support and having support and finding community. And then 2, this whole thing with COVID and long haul and long COVID is just this newfound commitment to self-care and to like listening to your body and like identifying what your body needs. And then, like you said, old Gwendolyn would have just kept going on and, forgot that the timer went off. And yeah, I can relate to that completely. But now here you are in this place of saying like, no, this is a newfound commitment that I have because I know like when I take better care of myself, like it's not selfish to do that because I'm helping myself, but yes, I'm also being a better human being, like for the people I love, right?
Exactly.
Your wife and your kids and, the other people in your circles. So it's really, really powerful. And, I can hear that, that development and like this growth that has come, as a, result of
quite a journey. And by no means is any of this easy. And by no means am I all the way better. I still suffer. I think the key for all of us, because it's a chronic illness, it's not going away tomorrow, and we've been at it so long, is to find ways to cope that also help us heal. Yeah. And helping others helps you feel good.
Mm-hmm. And I also wanted to, comment on this like self-advocating place that you're into of like taking it on yourself to do the research and see what is out there, like what can you do for your own health, and like how can you
Hmm.
advocate for yourself, like not only just in the doctor's office but within like your own healthcare journey as well, which is something so important.
For sure. For sure.
Mhm.
And I know it's hard to speak in specific terms in this, because I know lots of people will see this, and all of us have a myriad of different things, because the
Mhm.
virus can affect different parts of the body. Um, but just as an example, with the mast cell activation, there are lots of foods that you cannot eat. And 2 days ago, I was in tears, like, I can't have berries. Like, berries have brought me joy.
Mhm.
Like, literally, you have to find joy in the smallest things when you're chronically ill. And now you're taking away my joy, my berries and my citrus fruits and all these things. But so I was really upset for a while, but then I started looking at what I can eat and getting creative. And I love to cook. So when I have energy, so now I'm looking at like the positives and the new things I get to learn, like how to make mango ice cream from scratch with fresh mangoes and coconut milk. And find a new thing to bring me joy. And those little things just take us so far when you're dealing with 9 months of
Mhm.
10 months, a year of feeling horrible, having no energy, people not understanding you. So it's these little techniques. And it's funny, you could say the whole world needs to do that. And maybe that's the universal lesson of COVID is slow down. But it's working for me for sure, to just take stock. And energy management, energy budgeting is the
Energy
key.
management. Yeah, what a
Yeah.
great term. Yeah, and it sounds like you're doing many things. And and I imagine too, like, you said, you spoke to this, a little bit earlier about kind of that, okay, you're understanding what it's like to be managing your health and managing your time and managing your symptoms, but it's a learning curve for people in your life too, and helping them understand like this is something real that you're going through. What are some ways that you have helped people understand that place that you're in, and to what extent?
Right. Let's see if I can keep this train of thought. Uh, in my personal circle, now that we're able to see some friends and family that are also vaccinated, and just my whole family is vaccinated, and I still wear a mask whenever I leave the house. But I stayed with my best friend when I went to Seattle to see this physician, and we went out for lunch, outside restaurant, and we walked from the car, and she's doing her city walk, healthy walk, which is much too fast for me.
Mm.
And I tried to keep up a little bit, and then I just stopped and I said, "Hey, I just can't walk that fast anymore. Can we slow down?" So educating the people around me, like, hey, I can still go out, but we need to move slower. And that makes me feel good for saying, hey, this is what I need. And also to realize my friend isn't going to be like, oh, well, I don't want to go out with you anymore because you can't walk fast. It's educating the people around me in that sense. And then also advocating is on social media, trying to post more in my own feed so that my friends and acquaintances and the people reading it understand, like, oh, this is what's going on. I don't know anybody with long COVID, but wow, it's hard to see you go through that. And I had no idea. To also then being active on the COVID long hauler Facebook group, my state Facebook group. I had volunteered to be the moderator and the lead for my state with long haulers COVID support, but I'm just not well enough. I can't keep up with it. So also being able to say, hey, I want to help advocate, and I just can't. So those are different ways that I do it in educating the people around me and learning more, just on my own, and then posting journal articles and posting links is my advocacy way right now. I'm not a huge fan of social media. I actually opened up my Facebook page that had been closed for 5 years.
Yeah.
Because I wanted to advocate and I wanted to get the word out there. And it was a little weird coming back from 5 years and being like, hey, I have this chronic illness. Isn't that cool? But it was helpful in a way, just one, the reaching out and knowing people care, and two, knowing that I can help educate others. So
yeah, wow. I'm laughing, Gwendolyn, just because that's exactly the same thing that happened with me in social media. Facebook had just been dormant for literally years, and then COVID-19 and the long haul thing, and using that as a platform for advocating and awareness and education. And it sounds like there's so many different avenues that you're kind of holding together here, and how you are doing that with those around you, and bringing awareness.
And I also sorry,
no, go ahead.
I also copy because I have a scientific mind, and I've now been trained how to read journal articles, published peer-reviewed articles. Whenever anything comes out, I print it and I put it in my folder. And I also send links to my physicians. There was a new Journal of American Medicine article out about cardiac effects of long haulers and percentages of how many actually have a certain percentage of cardiac function, but it doesn't show up on EKGs. It only shows up on specific imaging that is not routinely done. And so just realizing like, hey, if you did this test, you might see that my EKG is fine. And I don't need a stent, but I've lost 30% of my cardiac output ability, which affects my oxygenation levels, which affects my pulse rate, which affects my blood pressure. And so helping the doctors, because, hey, they don't have time to sit and read all day long. And I don't do that either because I can't. But when I do see things, sending those things to my doctors and posting them on Facebook so other people can see is a form of advocacy that makes me feel better, because maybe that article someone will read and it will help them get the care they need, even if it's not specific to my disease process.
Oh, that's so incredible. And yeah, what an amazing thing to be able to do, to come, to step into, your, a doctor's office and help, right? Because you're saying like, okay, this is the care that I deserve, and I'm going to help my physician, give me that care that I'm needing, and in supporting that, because you're right. Like there are, hundreds of articles that are published, daily, and anyone doesn't have time to sort through all of those, but how great to be able to, not only say, hey, this is going to help me specifically in my, in my healthcare team, but also helping other people who might not know this is available, and or be able to have, look through this journal article and dissect the important pieces and and pull out that information. So just in a remaining few minutes here, Gwendolyn, just wanted to ask you if there's anything that you would like to share with a fellow long hauler, advice or recommendation for for people who are in this place of really feeling overwhelmed and not sure how to get through.
Sure. Been there. I've there have been days where I don't want to get out of bed because I can't face it. There are days I want to give up. We recently lost somebody in the COVID group to suicide, and I've been there too. I've thought about it. It is hard. I'm smiling. I put makeup on, but like I shaved my head the other day because my hair is falling out so much. And also I don't have the energy to deal with my hair. I don't even have the energy to put it up in a ponytail anymore. So guess what? This just made my life easier. But the coping and the dealing and the overwhelm, take it day by day. If you have to, take it hour by hour. If you need to break it down to minute by minute, advances are being made every day. the doctors, the scientists, the researchers are really, they're trying, and medicine and science move slow.
Mm-hmm.
So stay positive, whatever that one thing is, if make a goal for the day. And if you can just accomplish one thing, even if it's brushing my teeth, because how many people have not brushed their teeth for a day or two or three because you don't have the energy. So if that's the one goal that you can be like, today I'm going to brush my teeth, and you do it, that's a success. And sometimes you have to break it down that small. Sometimes it's tonight, I'm going to help prepare dinner with my family tonight. And that's your goal. And maybe all you do is wash the potatoes. But so that's some of my advice. Reach out. There's so many groups on Facebook offering support and help. There's websites for dysautonomia, for POTS, for chronic fatigue. All of these things that we're being diagnosed with aren't new. They're out there.
Mm-hmm.
Find support and network, and treat yourself like you'd treat your best friend or your spouse. If your spouse was suffering, what would you tell them to do? And or your best friend or your parent or your child, and treat yourself as you would treat those closest to you. And take it day by day. And don't forget to breathe and drink water.
Breathing and drinking water. Sometimes we have to get back to the basics, right?
You really
to remember, like, what does the body need? Water, hydration, rest.
And now that it's warm out again, get outside, even if it's just sitting on your front porch stoop for 10 minutes in the sunshine. So
healing. And something I'm reminded too of what you said earlier is finding little things that bring you joy.
Yes.
Just, like making, a new recipe with, mango coconut smoothie, right? Just, infusing in just a little bit of something that brings
a little joy. Yeah.
Oh, that's so beautiful. Well, thank you so much, Gwendolyn.
Thank you for having me.
For being here and just sharing such an important piece of your story, and giving light to that and bringing awareness to this invisible disability. And
very true. If I could help just one person in the smallest way, then it's all worth it.
Yeah. Well, thank you so much, Gwendolyn. It yes. Sure has been a joy and a pleasure and an honor to hear you and share your story. So thank you for being here.
Thank you.